Ain't no how stepping with Marcus J. Thank y'all, everybody, for staying with us as we progress through the show, as we do every single week. As we do every single week, we always profile a missing and/or exploited child. Tonight is no different. Tonight's child is Zahi Bell. Zahi Bell is a black female. She's 15 years old. She's been missing since July 31st, 2014 from Manassas, Virginia. She's got brown hair and brown eyes. She's 5'10", weighs 120 pounds. She's 15 years old. She was last seen again on July 31st, 2014, wearing a white top, black shorts, black bonnet, and glasses. If you have seen Zahi Bell, please contact the National Center for Missing and/or Exploited Children on their website, missingkids.com, or contact them by phone at 1-800-THE-LOST, 1-800-843-5678. Please bring home Zahi Bell. Ain't no how stepping with Marcus J. All right, at this time, I'd like to introduce our next guest joining us here in studio, as she does from time to time. I got my sister Tony here.
What is up?
What it is?
Not too much. It's Monday.
It's Monday, yes. How you are doing today?
I'm doing pretty good, thank you.
Thank you. Thank you for being here.
That's not what she said.
So what did she say?
Is this mic on?
Yeah, it's on.
Testing 1, 2, 3. She said it's Monday.
Oh, good grief. Here we go. You messing with me. This is what's been going on for the last few minutes since certain people came in here. Big Ruben and I was just vibing and stuff, and then certain people came in here, and she don't realize that they could hear you peeling your little nasty tangerine right next to a hot mic.
I think that's a whack clementine.
Actually, that looks kind of yummy.
Oh my gosh, she's peeling it. The listeners can hear you peeling a clementine slash tangerine. All right. Tony, Big Rube, you guys ready for our sister SY to kind of get us through while we're supposed to be brushing our teeth and all that kind of stuff?
I'm actually pretty much against it.
All right,
Okay,
SY.
brushing your teeth?
SY, let's do it. Jump in. It's your turn.
She took my mic.
Get the other mic, beef.
Why are you so aggravated? Am I provoking you?
A little bit, yeah.
I'm going to need you to get over it.
No.
Yes.
I got the way this supposed to go. You messing with me. Yeah,
So, you know, guys, it's really good to keep up with those dental appointments. It's really good to listen to your mom and your dentist and keep that mouth as healthy as possible. Not only for a bright, beautiful smile, not like a bright smile like Marcus says, but for a bright, beautiful smile. But you also want to avoid gum disease. And now I'm going to go through, oh dear, Ruben just made a scary face too. You know, both of you look like
My gums look good, girl.
Alien. The alien from the movie Aliens. When you did that little grit with your teeth just now. Yeah. And the mouth just kind of comes out and you're really scary.
I'm going to cut my own mic off so I don't say nothing mean to you.
You could cut it off. Go ahead and provoke me if you want.
Anyway.
So gum disease is a condition that causes inflammation of the tissues that surround your beautiful teeth. And as that condition progresses, the bones of your jaw start to erode. Funky mouth. So the commercial freshen your breath, that's not going to help at this point. Gum disease is caused by a bacteria that grows on the surface of your teeth and under your gums. So, hence brushing your teeth, if we keep them clean enough and we visit our doctor like we should, or our dentist like we should, we can kind of catch this and nip it in the bud. Scientific data has also revealed that gum disease can cause heart disease. Heart disease. So unless you're looking to grip your chest and say, Elizabeth, I'm coming to join you, you might want to help and save yourself. So I'm going to go through some things that you can use as your signs, and you know, if you're not going to the dentist like you should. So again, gum disease is a bacterial infection that surrounds the tissue of your teeth. First stage of gum disease is referred to as gingivitis, everybody. And there are lots of us walking around with gingivitis.
I actually have gingivitis.
So
I don't.
I don't.
This is
I brush my teeth.
Me
this.
too. And my gums. Look.
It's hereditary. So okay.
Tony's
Arsenio.
baby
She
alien.
just did the Arsenio over there.
So, gingivitis worsens and becomes periodontal disease. Now, my daughter has periodontal disease because, as you all know, she was born 5 months premature, and that's just one of her
I didn't know that.
issues. Yeah, that's just one of the side effects. So we do a lot of visiting and treatments and things to fight infections with her mouth. Another reason you should keep brushing your teeth, plaque, hence the flossing. Now, y'all can do this. This is what I do. You know that little hook that the dentist uses to scrape your teeth? I can't remember what it's called, but you can go to your pharmacy and you can buy it yourself with the Butler floss.
All of the pain they put you in at the dentist, you're supposed to go and get one and put yourself through that misery?
No. But see, this, what you're going to do with this, because most likely if you all just look in the mirror, inside your mouth, in the back of your teeth, then you can see where that plaque is building up. If you go like, if you take your tongue and run across the back of the teeth, I'm going in now, and you run across the back of your teeth, is it smooth?
Yeah.
Yes.
It's not supposed to be. It's called plaque buildup.
Really?
You're supposed to feel the grooves in your teeth.
Oh, well, I can feel the grooves. I can feel the grooves.
Then it's not smooth.
Oh, well, I guess I misunderstood the question. When you say smooth, I mean, I thought you meant the actual
not like
tooth.
clean or anything like that. Like,
Not like
if
a
you're,
baby's bottom.
if you
I thought you meant when you said smooth, the actual tooth. But you talking about in between the teeth.
right
Once
in
you go-
between the
okay, I
teeth,
got
you should feel the grooves.
So
in between
listeners,
your
everybody that's listening to us right now, if you listening to us, just run your tongue over the back of your teeth, and if you can feel the individual teeth, then you're good to go.
Don't swallow your
But
tongue.
if you can't feel the grooves in the back of your teeth, you probably have some plaque that you need to get
It's still time.
that you get checked out.
When we get off, run on over there to Walgreens or CVS and go pick it up with some floss. And here's a good tip. If you brush your teeth with baking soda, and you brush your teeth with baking soda, I guarantee you for at least a week, your teeth, the front, the back, your tongue, and you rinse with baking soda water, that plaque will come up very, very easy with the floss.
That's so disgusting.
I used to brush with baking soda.
Well, you can do it.
Nana used to have
clean
us
your
do
teeth.
that.
Yeah, my mom made us.
I think that's
made
an
us
older.
do
I
that.
used to brush my teeth with toothpaste.
But doesn't baking soda strip your teeth after a while?
No.
I don't know. I
No.
don't know. I know that Nana brushed her teeth with baking soda all the time, and whenever we was with her, she used to make sure that we did it
Yeah,
as well.
it is a whole new mouth when you clean your mouth with baking
But
soda.
it tastes like
No, but it doesn't
Tastes
taste
like
that bad.
It doesn't taste
It doesn't
bad
taste
at all.
that bad at all.
I used to use it. It tastes like toes.
Okay, you wasn't using the baking
You know
soda
what
that
toast
you
You know
put in
what
the
toast is?
refrigerator.
I smelled toes.
So we need to have a talk, a break.
smell toes.
Sure.
So are you saying baking soda tastes like corn chips? If you say smell
No,
now,
it just tastes like
Somebody gets down
old
with
dank.
toes.
I don't know how to
Gets
explain
down
it.
with
we don't talk after this.
toes.
But yeah, I mean, clean your tongue, and if you do
Yeah,
it for a good
scrub that
week
tongue.
and you floss, that plaque is gonna just start popping right out of your mouth. I'm telling you how to keep your teeth going. It's gonna come right out of your mouth, and when you look back in the back of your teeth, it's gonna be such a difference, and it's gonna feel 100% different than it feels right now.
You do that?
Okay? Yeah, I do it all the time.
Okay.
Do it all the time. Plaque also contains a bacteria that produces toxins that irritate the gums. Ruben, y'all, is doing the Stevie J chipmunk look.
Who's that?
Yo, that dude's like, if I had a
Loving
bad
hip-hop?
hero,
It sounds
that
funny,
dude
bro.
would be my bad hero.
Oh my god.
That's the only reason that Stevie J gets my that show gets my attention because that dude is hilarious.
My mom likes him too. She's like,
Stevie J is
you
he's
gotta
the
give
realest
him-
person on the
she's
show.
like, you got to give him props for getting what he gets and treating people the way he does.
He is real. That dude is
So,
real.
You know, but
I know.
I have
Is he
no
on
idea
cocaine or
who that
something?
is.
so over
I'm
time,
feeling like I'm glad that I don't know who that is.
No,
well,
you
you
don't
don't want to.
need
You
to
don't
know.
want
You
to
need
know.
to watch that show.
Yeah.
You know,
Be very-
There's nothing that could happen to me in my life
you don't want to.
Dude,
short of incarceration that would
hold
make
on.
me watch that
For
show.
instance, this dude proposed to 2 chicks at one time. Baby mama and the chick he was dating or seeing or whatever she was. And how about the chick she was seeing? She was seeing left, and baby mama stayed. That's how Stevie J gets down.
You mean when he gave her a ring
Yeah, that
for
was
their friendship and then
That was
proposed
the greatest thing ever.
to the other one? Yeah.
You know how much courage you know how much yo stuff don't stink to do that.
Blank stare.
But he gets away with it.
Blank stare.
Cause
So over
he's Stevie J.
time, that plaque hardens and turns into
doing
tartar.
like
Not
tartar sauce.
I knew somebody was gonna let it out. No. So
Trying to help you out.
when we're done tonight, right before you go to bed, I know y'all gonna brush your teeth and floss and pop that plaque. Right? So heart disease, there is a direct link between gum disease and heart disease. And it says that science predicts that if you develop heart disease based on your oral care, gum disease is going to be the cause of it. Just stop. You know it's Monday, right? Not Wednesday. You know it's Monday.
I have not said anything.
You look, said it all. That face did it all. So we're going to give you some signs and symptoms. Now, the bacteria, I want to warn you, and this is how it gets to be heart disease. The bacteria that causes the heart disease originates on the teeth and under the gum line. It travels into your bloodstream and then is deposited into the heart tissue, causing inflammation.
That's terrible.
So clean your bloody mouth.
Terrible.
Signs and symptoms. Gingivitis. Gingivitis is a mild condition that causes your gums to be swollen and red, and they bleed when you brush. So if you brush your teeth and you brush your teeth with a soft toothbrush and your gums bleed, go see the dentist. All right? If you're using a hard toothbrush, my recommendation is to change, because the only thing you're doing there is irritating your gums, and that'll just help let in some bacteria.
Joy is checking in.
Hey, Joy.
Joy is
Joy to the world.
Joy is saying love and hip hop, and she's also saying that I wouldn't know who this. What's his name is? Jay?
Stevie J.
Yeah, I don't know who that guy is.
Yeah.
Stevie J has actually produced a lot of songs that you know,
Mm-hmm.
Okay. Wow.
So,
but he's worth watching.
So yeah, so did like a lot of people produce songs that I know.
so periodontal disease is present when the gums begin to recede from the teeth. Now, if you see someone and let's say their teeth just appear to be long, they're not vampires. They just look extremely long.
You know what's funny about this? Like, because usually when you bring the healthy stuff, I would say 99.5% of the time I have no idea, so I'm learning. Like I'm learning. But everything you saying, I already noticed because you know I've had some issues with my mouth as I was growing up. And so I noticed stuff. So when you said they teeth look long, I'm like, yo, I know what you mean. It's periodontal because the gum starts receding.
The gum almost disappears,
Starts receding.
and all you see is the full length of the teeth. And if you all just take a look at I'm gonna try to get a picture of the mouth. Your teeth are actually way in the top of your mouth.
Yep.
So when I start to see like 3 inches of teeth, I'm a
You
little
should see what your
concerned.
tooth look. If you ever had a tooth pulled, you should see how long your tooth really
Yes.
is. That joint is locked
Your
into your
teeth is
jaw,
very
man.
long.
I've never had a
Yes.
tooth pull, yo.
Oh, I have.
I've never had a tooth pull.
Man,
My teeth
I never had a tooth pull before either, but man,
I take care of my teeth.
I was so excited about it.
About getting your teeth pulled?
My tooth, yeah, it was bad.
It was a wisdom tooth.
I had those surgically removed, but I had to get I left my wisdom teeth in too long, so I had a tooth that had to get pulled. But he had to he broke it off in pieces.
Painful.
Yes.
See,
They didn't.
I can't
They
have a
didn't drink
tooth
it?
Have it
pulled
enough.
unless I'm asleep.
So I could feel the wrench.
Oh, that's my boo.
You're not gonna take my teeth
That's
out my
what
head,
boys
and
right
I'm
there.
awake. So, just forgot where I left off. So, if you start to see, well, again, periodontitis is when the gums start to recede from the teeth, exposing the bone, which is the top of the tooth. So unprotected bones now become infected with bacteria. The gums get red and swollen, they bleed, and now we have a new problem. They're filled with pus. So they will ooze the pus. All right? So if your gums are bleeding, if you have gingivitis, or if you have plaque, I'm warning you. This is not a pretty picture, and I'm going to tell you right now, your breath stinks. I mean, there's really no other way to get that out. Your breath stinks.
Joy says that she had a root canal. She was awake.
Oh, yeah, well, they don't, I've had them awake. I haven't been put to sleep for a root canal.
I never had one of those either.
I wish there was a way they can put you asleep before they give you that needle.
I had the scaling done one time, and I swear I wanted to have domestic violence with the dentist.
Oh, I've heard that's really bad.
Yo, scaling ain't no joke, and
Why
they
I
don't.
gotta be domestic, yo?
I was trying.
He's
I was
feeling
just-
provoked
I was
at the
just- I was
dentist.
just-
Well, it
I was
wouldn't
just
be
trying to make
foreign.
an inappropriate
It's
joke.
just-
It wasn't funny.
It was funny.
Or it's gone,
No,
see?
I actually have to go on Thursday and get a crown. My first.
They get a crown?
Yeah.
Really?
Because my nerve.
Now the
exposed.
crown. Correct me if
Teeth
I'm
is
wrong,
cracked.
but a crown is when it's too far gone for a filling, right? And they have to cover.
Or if there's the nerve, they can't do anything to cover the nerves. You can't do the filling or nothing. Yeah, they put a
a piece
crown
of
on top of it to
it.
cover it.
Okay, yeah. Wow. Okay.
So,
Yeesh.
signs and symptoms of bacterial endocarditis. Now, let's say you go to the dentist and you get a bad review from your dentist, and dentist is forever, like the hygienist is just picking away
Forever.
forever in the back of your mouth.
In the back of your mouth.
I'm sorry, that was too easy.
You
Mouth.
risk a heart murmur.
Hold on, wait a minute. Jacked up mouth can cause you a heart murmur?
Oh yeah, you're in trouble. Your heart is really in trouble.
Joy said that she keeps cavities, but she heard that the MS patients have cavity problems. So, that's what
So
she said.
you know your doctor will be advising you on how to manage dental hygiene with your MS, Joy. So you should be cool with that from your doctor. Yeah, you can get a heart murmur. It'll also cause you to be fatigued, have weakness, muscle aches, coughing, joint pain, breathlessness,
All this
You get
from
all
a
that from-
jacked
I
up
gotta use
mouth?
that.
and red dots on your skin, your mouth,
Hold up. That's
and your fingernails and toenails.
All this from a
All
jacked up mouth?
this. No, we're not doing STDs this week.
It sounds like it.
spots on your body
Spots
from
on
your
your mouth.
Gonorrhea in your mouth.
But no, this is all from oral hygiene.
Ew.
Somebody's oral hygiene game is jacked up. They get all
Man,
that.
you got oral cooties, man.
You know, some things you can't help it. Like you say, sometimes it's...
No, you can help all that.
No, because if some things are hereditary, you know, you can't do anything about it.
So you're telling me that bad breath is hereditary?
It can
mean,
be.
yes.
It can be.
Oh, that's just foul, man.
It can be.
Yes.
If
First you
if
go-
your mama's breath smell like ass, it's a good bet that your breath gonna smell like ass.
First you're going to name your child something crazy, and then you're going to give them bad breath, too? They can't survive.
Get it from my mom.
They can't survive.
It's my mama.
I heard
That's really getting it from your mama for real.
Get it from your mom.
Oh, I don't know that song.
And that's when children need to start emancipating themselves and changing their name and stuff.
What? People.
Children need to still keep emancipating
Oh, I thought you
themselves
said
and changing their
something
name.
else.
And what do you think I said?
I thought he said something else.
What do you think I said? Come on, we grown people here.
What'd you think he said?
What do you
Tony?
think he said? Come on, Tony.
I thought you said something about children.
Come on,
What, Tony?
Come on,
What
Keith.
you
I'm not doing it. Y'all are making
We're
me feel
family here.
uncomfortable.
Okay, whisper it to me.
What are you talking about? Uncomfortable.
Yeah, whisper it in a hot mic.
Everybody knows, so why do I need to say
I don't
it?
know. That's why I'm asking.
Hey, look, I'll tell you off the air.
He knows.
I know.
What?
He knows.
What?
What did she say?
What did she say?
I didn't say anything.
All right.
It's
What do you think
thought
I was
he
saying?
said.
All
What do you think I
right.
was saying?
Did it begin with the letter E?
Boo.
The letter M?
Masturbating. Move
Oh.
on.
I said the letter M, and then you just attacked
on.
me.
Well,
That's
the
real
kid-
disgusting.
Kids
yo.
actually do that. So,
I mean,
Yeah,
but
they do.
Yeah, from the age of
Well,
2, according
yeah,
to
Oh,
Freud.
from
before
babies.
that.
Yeah,
Little babies.
yeah,
Yeah,
kids do that all the time.
So, functional
grown-ups, too.
abnormalities of your heart presented as heart palpitations, irregular heartbeat. I'm not even gonna. Chest pain.
calm down over here. You all flustered.
So,
Oh my God. Stop.
It's a race. Not right now, Mom. I'm
Okay.
busy.
Hey, don't have Stepin Marcus J. Having a little fun. 804-402-2893 to be down with us tonight as we have a whole bunch of fun in here.
so risk factors.
Make
there
your
you
own
go.
dinner.
There you go. Risk factors.
The risk factors of gum disease lead to heart disease. Heart diseases rises in people who
Hakeem
have
said
a
we in here
gene-
wilding out.
Hey, Hakeem.
Hi, Hakeem.
How you gonna sit there and talk about whatever it is talking about Hakeem?
What? We said hi. We haven't heard from Hakeem in a while.
He called in. He called
You
in.
should have
earlier.
been here at 7.
He called in earlier.
Anyway, hi, Hakeem. Yeah, just drop your mic. Turn it off, please, honey. All right. So now,
Yeah, you know what's up.
the risk of gum disease that leads to heart disease rises in people who have a genetic predisposition and those who do not practice good oral hygiene. So the teeth must be brushed twice daily, at least 2 times a day. Okay? And flossed at least once a day.
Floss.
Okay?
We getting a hit from Michelle K. Michelle K says that crowns are very expensive. She's getting hers in a month or so. She had to have a root canal due to an abscess. She didn't feel any pain during that experience. The only pain that she felt was the cost of the crown, which was over $400.
Is that with insurance?
She doesn't state whether it's with or without, but that's what she says.
Might
Yeah.
have to do layaway.
Ooh, layaway. They're going to put half a tooth in your mouth.
They're gonna make you stay there until you pay it off.
That's fine. No, I grind my teeth really bad, so I have a lot of them that are cracked.
Hakeem said, "What's up to you?" That's why.
Hey,
He
Hakeem.
ain't said what? I don't even know what's up.
He said he actually said them. He did say tell them. I said what's up, but since that's why I specifically said hey,
I did too.
I said her. So
Okay,
that's my
so
bad.
also
I think I just got fucked up.
patients with immune compromised, with your immune system is compromised with HIV, leukemia, diabetes. You can also suffer from gum disease, Mr. Diabetes.
I'm sure people that do a lot of methamphetamines have problems with this too.
Also high stress, a poor diet, those who smoke as well.
Smoke
All
what?
right.
What about people who drink?
Well,
a
they
lot?
didn't break down what.
What
but
about people who
smoke.
drink a lot of alcohol?
Well,
That too, because all the sugars.
well, that may
Sugars.
be. Yep. Mm-hmm. They
So-
didn't mention
so it's like
alcohol
as bad as
per
drinking a lot of
se.
Kool-Aid.
I'm
too?
smoking.
Yeah.
Kool-Aid or alcohol? Which one is worse
just
for your
brush
teeth?
your teeth. Most likely, the alcohol may have more
Yeah, 'cause
sugar.
It's fermented.
Mm-hmm.
Really? Okay. So I need to switch back to Kool-Aid? Okay. Nah.
Yeah,
Kool-Aid with
Mr.
alcohol.
Crown.
Yeah.
Little mad
I'm a
dog.
king.
So treatment, minor
also
gingivitis is treated with oral care from your dentist.
Well, maybe I think I want to become a dentist and only have female patients.
Sorry.
Well,
I'll tell you, boy.
I had to specify because I didn't want to look up because I know Ruben who was going to say something.
I know what you're talking about. I know what you're talking about. That wasn't me.
Marcus's eyes was that way. I was looking at Marcus.
See, I'm in bad company.
Oh, man. No,
No,
that's
you're
not-
not. You're in great company.
And
See your
Michelle K did
dentist.
answer the question, Tony. She says, yes, that is with insurance. So
Yo,
she paying 400 Benjis with insurance.
4,000.
400 Benjis
Out of pocket.
with insurance.
That's not that
Ain't
bad.
that something?
Okay, well, it ain't that
That
bad
was
'cause
four
it ain't yours.
G's.
So you are also advised to remember to keep flossing, and seeing your dentist for your regular cleanings. And in between your regular cleanings, I'm telling y'all,
Stop it, Ruben.
do it yourself. Do it yourself. Okay, I think the dentist is every 6 months.
Yes.
So there's nothing wrong with you, go online to your dental health insurance, and most likely they have a store that you can purchase your dental hygiene supplies at a discount. So you can go online, you can get those things, and you can treat your mouth yourself in between your visits. Severe gum disease requires extensive dental cleaning above your gum line. Antibiotics may also be prescribed to get rid of any infection. And extreme causes of surgery is also, extreme causes may, God darn, I can't read right. Extreme cases may also lead to surgery. If surgery, what they'll try to do first is treat you with an IV for 5 to 6 days, 5 to 6 weeks to clear the infection. If that doesn't work and the infection persists, or if your heart is damaged due to the medication trying to clean the infection or clear the infection, then surgery is performed to remove the infection. So that completes my segment for tonight. So really, y'all, there's so many things, like we say all the time. One thing leads to another, and we're all going to keel over for something. But if you can help prevent whatever you can, then would be advantageous to
The
do
moral
so.
of the story is, correct me if I'm wrong, SY, if we follow what we were told as children, and we brush our teeth twice a day and floss at least once, nature's going to do what nature's going to do, but you can prevent a lot of problems that you may have. And I was fortunate growing up that Pops J, because he had issues with his mouth and his mom had issues with hers, that they were very diligent with Big Brother J and Little Sis J to make sure that we always went. And so I always went. I have no memory of not regularly going to the dentist from when I was younger. And of course, I'm that way with Mama J. I make sure that she goes and that sort of thing. And I have oral issues. They're just hereditary. There's nothing that I could do. There's nothing I could do about that. So, but to find, and that's why I knew a little bit about some of the things we were talking about, because I kind of went through them. So, but that was good. That was
my
really
mom
good.
used to come in the bathroom. You brush your teeth?
Make sure.
Let me see.
Yeah.
And she would make you brush your teeth over again.
Yep.
Yep.
I do that. I do that with Mama J. I make sure that if it don't smell right, then you got to go back. Because you can't. You don't just go in there for a minute.
Now check this out. Let me say this, and this has nothing to do with what we just discussed. But if you have little children, and when I say little, I'm gonna say maybe up until about when do you stop helping your kids brush their teeth?
Depends on the kid, but I would say somewhere in the 7 to 8 range.
About that age. So sometimes you can eat food, and your food goes through the wrong passage.
Oh yeah.
Right? So you can get food stuck in your nasal passages, and that kid could be brushing their teeth like crazy, and their breath smells like the dog went.
Really?
Right? Seriously. Check the nasal passages. And it happened to my daughter. So if you check the nasal passages, if you clear whatever it is, in her case it was a spaghetti noodle, as soon as you get it out, instantaneously the breath.
But how do you know that it's there? Like, how do you know it's there?
Just
and
check.
How do you get it out?
If you know,
do you literally
that
open up their nostrils and look up their nose?
Well,
I'm not trying to be funny.
No,
I'm serious.
I'm serious. If you can see it, her grandmother literally went in there with a tweezer and grabbed the end of the noodle, pulled it straight out. And I went right back to smell the breath. It's gone.
Yeah.
The noodle itself, however,
Smell bad.
yeah, man. So you might want to check that too,
I
especially if
tell
you
you,
know.
it's something about grandparents, man, because I remember watching my godson's grandmother when he was a young fella and he had trouble blowing his nose and stuff. He'd be 2, 3 years old. And I watched her, and this might be the most crass thing I ever say on the show, but I watched her hold one nostril down and blow through the other one and watch all of the nose goop come literally flying out of his mouth, and then she would switch and do it, and it might be the most disgusting thing.
Oh, I thought you were gonna say suck.
Well, I've
she
I've
blew up
done
his
that.
nose.
she would blow through his nose, and whatever was in it, like if he had congestion or whatever, she would literally close one nostril and blow through the other one, and then his congestion would come out of his mouth, and it would almost come out like he's throwing up. And and so she would be prepared for that, but it was still disgusting.
And
then
it's
she would
common
switch
in
and
little,
do it.
very young kids who, if you use like an aspirator to clean their nose or anything like that, that's common.
That's disgusting. Ain't no how Steppin Marcus. All right, y'all. We're gonna take another break, and when we come back, we're gonna ask a couple of more questions. What the hell happened when an actress in Los Angeles was detained by the police? What was she doing, and why was she detained? A notorious child killer is making news again. I got the whole crew along with me. Miss Tony, S.Y., Big Rube. You know how Steppin with Marcus J. Be back in a few minutes.